And we're live.
So good evening, everybody. Welcome, good evening, and welcome to this virtual Wimbledon Community Forum. I've just had a very exciting countdown, which was helpful, but it made me sound like I was reading the news. So welcome, everybody. I hope you have all been safe and sound over the last few weeks. And it's good to see that a number of you have been able to join this evening. So thank you for that. We're going to run a slightly different meeting this evening because it's by Zoom. We have three speakers, and then we have a presentation from the Neighbourhood Planning Group as well. On this occasion, we won't do it on future occasions, hopefully, but on this occasion, I'm going to ask each of the speakers to address us. And then if you could please provide your questions by chat. So you'll see there's the chat icon on my screen, it's at the bottom. If you could put, please, your questions for each speaker onto that chat link, and Chris and myself will then make a note of those questions, and at the end we'll put them all to the speaker, who can then take whatever time they need to prepare and then answer all the questions together. So I know it's not ideal, and I'm sorry about that, but it's good that we're able to get together. I think it's important to be able to get together. And so I'm pleased we can, but tonight, unfortunately, we are by necessity having to run a little bit of a restricted meeting. So the first agenda item is the annual report from the Leader of the Council, from Councillor Stephen Allen Brittus. And you'll remember me saying this in previous years. He's going to talk to us about his inbox and we can all imagine it's been a very hefty inbox recently, and what's been going on at Merton Council and what's been coming across his desk. As you have questions, please put those questions in the chat, as I've said. We'll make a note, and then at the end we'll put all the questions to Stephen, and then he can take some time to prepare and then to respond in bulk. If you are watching this evening by YouTube, you're very welcome as well. And you can also ask your questions by emailing to getinvolved, that's one word, getinvolved@merton.gov.uk. Getinvolved@merton.gov.uk, and that's for those who are joining by YouTube. So thank you very much. I hope it goes well. And Stephen, you're very welcome. Thank you for joining us, and over to you.
Thank you, James, and thank you for inviting me. I always enjoy addressing all the fora, and always a good opportunity not only to say, as you stated, what's in my inbox, but also to take questions and do my best to answer them. As you'll all have known, these are tough times for the country, for London, and for Merton, and sadly, very sadly, 197 residents passed away here in Merton due to COVID, and I know that all our thoughts and prayers are with those loved ones, with the relatives, the families, the colleagues of those that have lost those loved ones, and our heart goes out to all of them. With regard to the pandemic itself, we're mindful of the disproportionate impact of the pandemic on our BAME community, and we're doing a piece of work through Public Health Director, and I know that Dagmar will be coming on later, and also working across Pan London and with Public Health England to see what we can do in the short term to protect that community, but also in the long term on health inequalities by working with the NHS. In Merton, we've shielded 7,019 people. I understand we've contacted each and every one to see what kind of support they need, not just from us, but from the government as well. And we've had great support from our food banks, but also from the staff here at the London Borough of Merton. And a lot of the staff, library staff, for example, libraries have been closed, wanted to engage, wanted to volunteer, and a number of the staff have been redeployed into other roles tackling the pandemic. And one of those redeployments has been our bailiffs. We suspended them from turning up on doors, knocking on doors and asking for monies, for debts, handing over writs, but instead knocking on doors and handing over groceries, food from the food banks. And that is a way that a new way of working, not just here, but throughout the country. There's been a lot of concern about PPE, and here in Merton, we have managed to have stock in place, even though there have been national shortages, and we have provided this free of charge to providers, to care homes, and we joined a pan-London effort, all 32 boroughs plus the City of London, in accessing a procurement exercise that means that we've got access to 50 million items of PPE here in London throughout the boroughs, and that is comforting. With the help of government, and we hope that the government will continue with this help, we've managed to accommodate 52 rough sleepers. There are 6 who, of their own volition, wanted to stay out on the streets. There's no force, but the 52 who are in temporary accommodation, we hope that with the help of government, that we can help to retain them in accommodation rather than coming back onto the streets. And I think that will be a better outcome for all concerned. With regard to schools, as a council, we've left that decision to head teachers, to teachers, to school governors, and with government statements, I think we're nearly there with most schools opening, including our specialist schools. And I think it was important to allow the head teachers and the school governors to take those early decisions in those early days. I think Wimbledon Library is now open, and Collier's Wood and Mitcham are open, and hopefully the others will be opening imminently. And Garth Road, our recycling centre, is open on a booking service, and we'll see whether it can open as normal. Some councils open them in the normal way and they had huge queues. The booking system seems to be working, but obviously we want to move to an open system. Our parks, tennis courts, the Wimbledon Park Water Centre, beach volley there, our green gyms are now all open, and we're hoping that the high street starts to gain momentum. And I want to thank Helen Clark Bell and Love Wimbledon for all their work, hard work in this respect, and obviously to Merton Chamber of Commerce and Diane Stirk there as well. Again, with the help of government and monies from government, we've been able to process grants to our small businesses. We were third in London for the speed with which we have been allocating those grants, and now we are moving on to discretionary grants, and those applications currently being dealt with independently of the council councillors. We're not on any of those panels. I think that's right, and so that's Merton Chamber of Commerce and Merton Volunteer Service Council dealing with those discretionary grants. With regard to transport, we have an emergency transport strategy as a result of COVID that is making its way through, and we've just been informed that we have been given monies from government to allocate 28 school streets, which would mean less air pollution for our children and their parents as they drop off in the morning and pick up in the afternoon. That's 28 school streets. The government urged us to do what is required, and that's what we're doing. That's what a lot of local authorities are doing. And all along, the government has been helpful with monies. But it's coming to crunch time now. And as we've done what is required, what does it take to help people, to save people's lives, we would urge the government to keep to its word and to fund not just us but all local authorities adequately. As at today, our estimate from our finance director is that unless government funds us fully, we will be £20 million gap just as a result of COVID. So there is a lobbying exercise being undertaken, not just from Labour councils, from Conservative councils, Liberal Democrat councils, all saying we will do what it takes, we are doing what is required, but we do need to be refinanced and reimbursed. I just want to thank Merton Mutual Aid for their support in Wimbledon in particular, in helping people to make sure they have their support that they need. I want to thank Wimbledon Guild. I want to thank Merton Chamber of Commerce. I want to thank Stephen Hammond, the Member of Parliament, for his sterling support of his local business community and his residents in Wimbledon during COVID. And I want to thank all Wimbledon councillors for their support, their work, and their involvement during these difficult times. And I do understand that the All England Tennis Club in the village down at Church Road has also been very helpful through their Wimbledon Foundation. On matters other than COVID, it's very difficult. I won't be long on this one because our attention has been taken up by COVID-19. Last night, the Cabinet passed the climate change strategy, and therefore this now goes to the first ordinary full council meeting. I think our next council meeting is the annual council meeting. The one after that is November. I was very impressed with Pippa Maslin and her talk at the Cabinet, and also with the commitment by Peter Southgate, our chair of the Overview and Scrutiny Commission. And it is our intention to do all we can to move forward. But I do need to say that that does come with a warning, and that is, again, we do need support from the government. The aim to be carbon free by 2030, as far as the council as an entity, as a building, as members of staff, as councillors, as its libraries, its recycling centre, that is a cost of £88 million, and we don't have that kind of money, so we'll be lobbying government. The aim to be carbon neutral by 2050 for Merton as a borough, as an area, as a population, 80,000 houses, 220,000 population, so many cars, and etc., etc. That is a cost of £3 billion towards 2050. Again, we'll be doing some heavy-duty lobbying with the government to access these kinds of monies because we don't have that. We are willing, we want to move as fast and as quickly as possible, but the monies must be there too. As I said, the annual council meeting is coming up. Whether it's virtual or physical, we will go ahead. A lot of boroughs, I think, have had an annual council meeting that's been virtual. My preference is that the respect for the first citizen of the borough, the mayor of this borough, is that it should be physical, so that relatives, friends, colleagues are there to celebrate a new mayor-elect. And so we are, of course, saddened that Councillor Janice Howard, her year, it has not been a normal year, but she has nevertheless done a lot for our residents on COVID. She has been around, she has visited care homes, and I think she will be undertaking an online auction of to raise money for charities. And our mayor-elect for 2021 is Sally Kenny, who's looking forward again to what will be again another short mayoralty. So what I have said to both of them is, in the new administration 2022 onwards, if all parties are magnanimous and understanding, then we should not be opposed if their name pops up again, so that they can get a grand full year as mayor. We have some issues with unlicensed musical events, and we're working closely with Sally Benatar, the Borough Command Unit Commander, to stop these events, which are dangerous for COVID and noisy for our residents. And finally, from me, we should all celebrate the fact that AFC Wimbledon, the club that was kicked out in 2002 from the borough, are now virtually ready to move back in. They have moved in office-wise in terms of the administration. I think they are at Plough Lane. They are at their new stadium. We've all seen the pictures of the turf, the grass, the pitch, and one of the stands virtually finished. And that will bring huge benefits to that whole area of Wimbledon Park. And hopefully there'll be copycat tactics with other investors coming in to place themselves in that area. And I know that it was an all-party, cross-party motion some years ago, and we all supported it, all the parties. And I want to thank the local councillors in Wimbledon Park for their support that the club should be back in Merton. As we've said, a club called Wimbledon should be in Wimbledon. Our safety advisory group is working with the club at the moment for safety issues that are paramount and important, working with TfL, working with transport authorities to make sure everything goes smoothly. I can't tell you when the first match will be, who it's going to be against. It'd be great if it was versus Liverpool, who they beat in 1988 in the FA Cup final. But it's great news that along with Spurs, new stadium there, Brentford, new stadium there, and here in Merton, we'll also be having a brand new stadium. Thank you for inviting me and affording me the time to say a few words. I know Dagmar will delve into public health issues, health inequalities in her talk. Very happy to look at the questions and do my best to answer them when the time comes. Thank you, James.
So, Stephen, thank you very much, and we all got your love of and bias for football. So thank you for briefing us on that. And I actually remember 1988 as a boy. I remember going down to the town centre and seeing the cup being paraded. So, Stephen, we've had some questions through, and Chris may have some by email. Can I ask you? We'll give you as long as you need to prepare, but can I just ask you to make a note of them, and then when you're ready, come back. Yes. The first one, and some of these you may not be able to answer tonight, of course. The first question was whether you have any knowledge, but of course, as a local councillor myself, that could come to me, but whether you have any knowledge of plans for a Hayden's Road low traffic neighbourhood area. The second question is, given that at one high school, pupils have been told to avoid public transport next academic year, what do you think of the prospects of having a bike training over the summer or early in the new academic year? Could that be a good idea? A further question is that the discretionary grants that are going to business, part of the guidelines are that they should go, that businesses that are seeking to reduce the inequality between the west and the east of the borough should be preferred. So could you comment a little bit on how that might be measured and how companies could participate? Because the questioner is saying on first sight, it could be that some companies just simply won't be able to do that. And then the final question that I've received, although I can see others coming through now, but the final one I've received is given that at some point COVID-19 will have to be paid for, could an increased council tax on higher bands be a good way of paying for that? And I gather there's nothing on email yet, so a mixed bag there. If you want to pause for a moment, because it's not going to be a test, if you want to pause for a moment before coming back, then please do. But otherwise, when you're ready, the floor is yours.
Thank you very much, and thank you for those 4 questions. So with regard to whether I have any knowledge that Hayden's Road may or may not be a low traffic neighbourhood, hasn't come across my desk. I will ask my Cabinet Member for Transport, Councillor Martin Welton, and he'll get an answer for Chris, who can share it with the minutes and the notes that are on our website. We do quite a bit of bike training, but I appreciate the point with regard to this summer for our school children. Yes, I will take that away and talk to our Director for Environment, Chris Lee, to see whether we can extend the bike training sessions that we have for everyone, but I don't know whether they can concentrate them in the run-up to the school term. We'll do our level best and I'll see what can be done there. With regard to the discretionary grants, I have to say this is about £1.3 million from the government. And if that was shared at, say, £10,000 each, that's 130 businesses. So a lot of businesses will be disappointed. I know that some of the apportionment has been for charities, charitable organisations. And so it may be that within those charitable organisations, there will be those organisations that do exercise a bridging the gap kind of service to the residents. I'll certainly look at that. The process is underway, and as I said, it's independently run by Merton Chamber of Commerce and Merton Voluntary Service Council. But I understand where the question is coming from. The council tax is heavily prescribed by central government. Central government sets most of the wording and gives us the parameters within which we can increase the council tax, freeze it or reduce it. But certainly in terms of the increases, those are set by government. If you go above a certain level, that needs a referendum. Will be guided by the government. Most local authorities, 95% last year, went for the permitted level of increase set by the government, because that was synonymous and tied in with the funding that those local authorities gained from government. That is, the government assumed that local authorities would take the permitted level of increase suggested by government. And so we will be guided by government on council tax levels.
Yeah. So Stephen, thank you very much. And my mistake, it wasn't Hayden's Road, but Hayden Park Road, if you are taking that back. So that was my error. So Stephen, thank you very much for your presentation this evening. Thank you for answering the questions you've answered. Can I just remind everybody, it is a slightly unusual meeting this evening, so please do send me your questions whilst the speaker is speaking. So Stephen, thank you so much. Thank you for joining us, and you're welcome to stay, but I appreciate you've got a lot to do if you need to go, but thank you very much.
Thank you.
So next we have Helen Clark Bell of Wimbledon, of Love Wimbledon, the Business Improvement District. And Helen, you're going to give us an update on the Merton Town Centre, and you are always a regular attender and supporter of this forum, so thank you very much. It's good to see you, and over to you.
Thank you very much, James, and thank you likewise for inviting me along here tonight. I mean, similar to Stephen, really, the tone is quite sobering at this time. And having spent 25 years as a local resident and 8 years in my role at Love Wimbledon, where we've been working extensively to improve the town, its attractiveness and its vibrancy, it's very, very hard to see it in lockdown. However, we're pleased to see that things are starting to come back to life. But just wanted to give you a little bit of a feel as to the work that we have been working on behind the scenes, so that because it may not have been immediately obvious to attendees and viewers of this video. So Love Wimbledon, as a business funded organisation, has found more than ever probably that these times have demonstrated the absolute importance of the connectivity between businesses and the local community. As businesses were closing their doors, we had a lot of them just knocking on our doors and ringing us saying, we've got hundreds of eggs to get rid of, trays of vegetables, we've got boxes of shampoo, we've got numerous things that we need to get rid of and we need to rehouse. And we were able to connect those businesses directly with the local community groups that had already set themselves up. So the likes of the Merton Mutual Aid Group and Wimbledon Guild and local Don's Action Group and Merton Giving and Wimbledon Food Bank, etc. Also, when those particular community organisations and charities had a particular need, we were able to go to the larger businesses that are in town and appeal to them. And they also made significant donations during this time. So Tesco's and Wilko's regularly, in particular, stepped up to the plate on that and really supported those local charities at times of absolute need. We were also able to provide a number of volunteers from furloughed staff from our business community to help out delivering prescriptions from the local chemists, etc. So that was also a strong connection that we were able to lever in between the business community and the local residents. We were hearing about kitchens that were being repurposed to provide meals for the NHS. And actually, I've recently found an empty office for free for a charity to be able to sort all of their donations in. So this community connectivity is absolutely coming to the fore right now and demonstrated very loudly. With regards to the business community, obviously, there was a maelstrom of information coming out in the early days and actually still to a degree. And it was often very difficult for businesses to understand what was going on and how they could access support. So we were, along with Merton Chamber of Commerce, providing some very clear support and guidance for those businesses to locally access the support they needed, as well as providing some very clear webinars as to how they could access things like the furlough scheme, etc. So being that local point of contact for the business community was a really important role for us at that time, and actually it continues to be so. For the businesses that stayed open, which was around 50 businesses in total, we were able to provide pavement vinyls to support the queuing to ensure that social distancing could be managed. We were undertaking joint reassurance visits with Love Wimbledon and the police, obviously at a social distance, so that those business managers knew that they were supported. And there was at one stage a fear of rising crime, which actually never materialized. But when the town centre was very, very quiet, there was a concern as to what could happen at that time. Fortunately, nothing did, and we were very pleased that we were able to work closely with the police to provide those reassurance visits. Likewise, when businesses were struggling, we were able to start to identify some of the cracks that those businesses were starting to support, to fall through the support network that had been created. So that's from central government, from the government funds that were allocated and delegated to Merton Council. So we were lobbying very hard for Merton Council and through Stephen Hammond and to the High Streets Task Force and directly to MHCLG through our partnership organisations to draw attention to the fact that there are a number of businesses in the town centre who have received very little or no support because of various circumstances that they're in. In particular, we've been supporting the Raise the Bar campaign, which if you're, I don't know how many people are aware of this, but there was an arbitrary £51,000 threshold set for the rateable value of premises, which really decided how many businesses could be allocated so many of the grants. We have been lobbying for that to be increased within London in particular, because obviously that's a disparate threshold for London businesses. So we were very keen to see if that could be changed. Stephen has alluded to the fact that we've been doing the Reach Out and Connect webinars, so co-hosting those with Merton Chamber to provide information and guidance from various experts on the support available, but also latterly guidance on how to reopen from the Regulatory Services Partnership at Merton Council. So it's been a very friendly support that the Regulatory Services Partnership have been availing themselves and really giving a lot of their time and energy and enthusiasm to encourage businesses to brave the new dawn, as it were, and understand how they can reopen safely. With regards to residents, we have kept the information flowing about who was open. As I said, about 50 businesses stayed open during the entire lockdown. Some of those offering just delivery and takeaway, but obviously we had our essential services remaining open through the supermarkets and the banks and chemists, etc. We were also delighted to be able to share the good news stories about how the businesses have engaged with the local community through financial donations and the foods and supplies donations that I've mentioned, but also those that have repurposed themselves, like Leon, who produced a little mini supermarket. So when you couldn't get flour, you could get it at Leon's. And other things like manufacturing face visors. We had two companies within Wimbledon Town Centre who were actually repurposed their facilities to produce face visors that we've been able to give out to local businesses, so local chemists and small independent businesses that were going to struggle to find that PPE. And also one Wimbledon business, obviously it's not necessarily, the factory isn't based in Wimbledon, but they actually repurposed their entire factory to provide free hand sanitizers to the NHS. So we've got some really lovely stories that are available on our website for everybody to see, but it's important to acknowledge that, you know, it has been a time of hardship, but actually the coming together of the community has been an important part that we need to celebrate and continue to work with. So providing reassurance about the town and what was happening and what is happening is a really key role that we've undertaken over the past few months. So with regards to reopening the town, we have undertaken some deep cleaning, some jet washing, and continue to maintain the graffiti removal service that we provide. The hanging baskets and planters have been provided by the All England Club. We're very lucky to have our relationship with them, and I don't know if anybody's visited Wimbledon Town Centre recently, but on the piazza and on the station forecourt we have two very large planters that were designated towards court number 1, and we're now proudly able to host them within Wimbledon Town Centre, and which we thank the All England Club for those. We've put up our lamppost banners. We've provided 2 public hand sanitizers that are foot operated in the town centre. And we've worked very closely with all of the businesses so that they understand how they can open and be safe and responsible, so that from a consumer perspective, we are making the town centre as safe and clean and as comfortable as we possibly can. We've launched a very strong Love Local campaign, which hopefully some people have been aware of and seen around the town centre. It really is to encourage everyone to patronise your immediate locality. The businesses really need your support right now. So many of our businesses have posters in the windows, brightly coloured in yellow, saying that they are now open or they're coming back soon. And it's a sense of building that community and really encourage you to use all of your businesses within the town centre. We started our markets a couple of months ago. We've got the next one on the 1st and 2nd of August. It is a smaller than usual market, as you would expect, to allow for social distancing, but it is very, very local. And again, these are independent traders, mostly local residents, who are trying to make their business work. So again, please do come along and support your local residents who are setting up their businesses and using our market to access the public. So to keep in touch with everything that's going on, please sign up to our monthly newsletter. Follow us on social media. We're active on all social platforms, actually with the exception of TikTok. Sorry, we haven't gone there yet. But we are here to help the businesses reopen and help the town recover so that we can all enjoy our local community once again. And obviously very happy to take questions, or do contact us in the usual way if you have any ideas or questions. We are very, very keen to hear from you and will respond very promptly. Thank you very much.
So Helen, thank you very much for that, and thank you for all you do and your team does for the town centre. There are no questions that I can see, but I have seen the comment, as you will see yourself, that says we're very lucky to have Love Wimbledon in our community, and that's absolutely right. And it was really good to hear some of your stories and before you, Stephen's stories about people pulling together and helping each other and getting involved in helping neighbours. So thank you for sharing those. And can I just echo your comment about buy local and support local businesses, and hopefully every one of us this evening can commit to that and commit to asking our friends and neighbours to do the same. So Helen, thank you so much for your presentation this evening and for giving us an update on the town centre. So now we move to the next agenda item. And I'd like to welcome Dr. Zagmar Zuna, who is the Director of Public Health at Merton Council. So Dagmar, thank you so much for joining us. You're very welcome. And you're going to give us a briefing on the impact of COVID-19 within the borough. And can I just remind everybody again that if you have questions, if you could ask them during Dagmar's presentation, and then it will give her the opportunity to answer them in bulk at the end. So Dagmar, thank you very much, and over to you.
Yeah, so good evening, first of all, and many thanks for inviting me. So purpose of tonight is that I talk a little bit about the COVID impact in Merton and what we know so far, which is at the moment limited to what I call the direct COVID impact. And obviously later on, we will do a lot more analysis for indirect impact. So a bit of an overview, pretty basic. I then want to touch on outbreak control because you will have heard that that is now a local authority duty. And then I want to share some really important messages with you. It's also an ask to you as people very connected with the community, how we can join up our efforts to protect our community. And then obviously I'm very happy for any questions, and if I can't answer them, I will take them back. So if you move me on, Chris. So this is a little bit about impact, and as I said, direct. So I'll give you one slide that shows us positive tests and one slide with death. This is now the familiar curve that you will be aware of. What is important with understanding positive tests is that they do not tell the full story. So positive tests is what it says, but a lot of people, particularly at the beginning of the epidemic, didn't get a test. So the big wave that you can see were only tests that have been done in hospital of people obviously who have gone to hospital because the disease was severe. So as a total understanding of how many people in Merton have been infected, this is a huge underestimate. But because everybody was in the same boat, we can still do a little bit of a comparison. And the way we do it is by rate per 100,000. And you will see that Merton had a fair chunk. Yeah, so we're 25th out of 32 boroughs. So that's just a very brief overview over infections. You will have probably also spotted, or at least some of you, that from middle of June onwards, so for the last sort of 2.5 weeks now, it looks as if we had more infections. Those who have followed the figures, and they are publicly available on a daily basis, saw a jump from 700 to over 900. And that is purely a reporting issue. Some of the residents have come back to me quite alarmed. Those that check the daily trackers and said, have we got an undetected outbreak? No, we haven't. I can assure you I am like a hawk on the numbers. It was simply that they have added in what is called Pillar 2 testing. You see at the top of this slide that we specifically say it's Pillar 1 and Pillar 2. So that's a bit of NHS jargon, but basically Pillar 1 means these are NHS laboratories, and they have been used at the beginning of the pandemic almost exclusively. And Pillar 2 are the much wider available testing facilities now run by commercial companies. And it's only recently that data has become available from the second Pillar 2. So it is only dealing with a backlog, not any undetected outbreak. If you move us on. Chris, could you give me the next slide, please? That's 1, 2, 5. That is one before. That's it. So that's the second slide. That is the tragic one. Stephen has already mentioned this. So these are the number of deaths registered among Merton residents. And again, you will see the familiar wave shape. What I think is really important is that when you look at the middle bit where we have the peak, you see that there are 2 shades. And actually, the lower shade with the smaller numbers are the COVID deaths, and the bigger chunk with the lighter color are non-COVID deaths. And the blue line that goes all through that graph shows you the comparable numbers for those weeks in the previous year. So it's quite a shocking slide because it is in your face how much additional deaths have happened over that relatively small time in March and April. And the disturbing message, and we're still working on it, that yes, we had additional deaths due to COVID, but we had actually a big chunk of additional deaths to non-COVID. So people are hypothesizing and trying to find out what was this all about. So one explanation is that we had a lot of underreporting of COVID, because as I've just explained to you, testing of COVID only happened in hospital. We know that the majority of death happened indeed in hospital, but a big part of the death tally was also from our care homes. And those people didn't get tested. And so it might well be, it is a very likely explanation that part of what was labeled non-COVID death, in fact, was due to COVID. But there are other hypotheses that we have to take seriously, and that is what we call potential indirect COVID impacts. So if people with serious disease have felt afraid to go to the NHS with serious disease. So as you can understand, it wasn't only in Merton that was observed. It is a pattern that is repeated in London and nationally. So a lot of analysis is happening now to unpack a little bit more in what is underlying, and with the purpose, obviously, of learning. The good news is that you see at the tail end of the wave that the numbers of deaths have gone back down. We had a few weeks where we were actually lower than at the same time last year. Then we had a blip 13th to 19th of June. And so we are now more or less same as last year. So that is the brutal truth of what Merton has endured and suffered. So if we move on. You've heard a lot, Stephen has already mentioned it, and we are all very much looking at the particular disproportionate impact that COVID had on the community, because it is not that everybody was impacted the same. As you are well aware, being particularly from Wimbledon, old age is the biggest risk factor, and so Wimbledon residents have taken their sad share. But the other big inequalities that have been observed is inequalities due to deprivation. And for us, it's a very stark picture when we draw the east-west boundaries. You see that the initial 1st of March till 17th of April chunk of data we had saw quite a profound difference in death between the east and the west wards. This differential has reduced towards the sort of further bit of the epidemic in a way that's, I think, good news. But a differential remains. And we're trying again to get more specific Merton data, but it's quite tricky because on the death certificate, the data that we get from ONS do not report ethnicity. And you will have heard in the press, there's a lot of reckoning now, but that is not good enough and will be changed. What I've done though is I've tried to overlay different data. So these are ecological data, but they tell quite a good story. So the top one shows you the size of the red dots are the actual numbers of deaths. So the bigger the dot, the more death. And then the underlying shading in Merton, the top graph shows you where our BAME communities live, and lo and behold, we have big dots where the underlying shading is bigger, is darker, so in the eastern part of the borough. But the most striking, and there is a variety of other maps that I haven't all included, the most striking is the one about high-risk occupations. If you can see in the underlying pattern, very, very striking where the large dots are. And that is obviously not surprising, because what we mean by high-risk occupations are those that have high exposure and little control. Yeah, and that's one of the biggest risk factors. So if we go and move on, Chris. So I thought, I will not go through all the details now, but I thought for your reference that might be a helpful table that tries to summarize what we know about the disparities in COVID mortality. And as I said to you, it is very significant, particularly for Wimbledon. Age is by far the biggest risk factor, which means in a way, or it includes the death we had in care homes, because the majority of death in care homes were in care homes for older people. Men are also more likely to die than women, and there is a mixed bag of explanations underneath. There might be some biological significance in that some important coding areas seem to sit on the X chromosome, but more work needs to be done there. Very important, and Stephen has mentioned it, there is irrefutable evidence that the BAME communities have suffered a disproportionate effect, and the association is not only for death, which is obviously the most extreme, but also for infections, for hospital admissions. And it is clear, and there is clear evidence, that the main underlying drivers for that are, as we said, deprivation, and then higher risk occupations, those that expose you, overcrowded housing, and prevalence of comorbidities, so particularly diabetes. And for me, the important message there is, yes, we don't know all the nuances of that data. And obviously BAME is not a homogeneous group by any stretch of the imagination. But the drivers of this disproportionate effect are mainly socially patterned. Even comorbidities, what we actually found is that people with poorly controlled diabetes do so much worse. And why is your diabetes poorly controlled? That is socially patterned. So the biological component are actually really small. And what that means is we can do something about it. And for me, that is the call to action. If we move on. So in a way that segues quite nicely into a very brief overview of what we're doing about outbreak control. So we obviously all have just come out of a big pandemic peak. And so what we're now dealing with is generally low infection rates. It's really important. We're all very, very alert, and we are taking a lot of protections, but infection rates are very low at the moment in London, luckily. What the idea is about the local outbreak control is that we've learned about in COVID that it actually behaves a bit different to flu. You know, initially we thought it's just like flu, but it has much more of a propensity to cluster. So sometimes transmission is just not happening, and other times, and we are not quite sure that we know all the ins and outs, a person or a few people can set off an avalanche of infections. And you have seen it internationally, but also closer to home. So Hillingdon Hospital, 70 people, the farm that had an outbreak. There was in Nottingham Hospital, I think, you know, a whole unit of orthopedic surgeons who shared a staff room, had to self-isolate. So it is a clustering disease, which means that going really after individual cases and ensure that they self-isolate is absolutely fundamental for effective outbreak control. The idea is that local authorities now have a duty to complement in the NHS test and trace. It is important to understand that the emphasis is on complement. So local authorities have not been given the means or the duty to do the main testing and contact tracing. That is very much established as a national NHS service that is overseen by DHSC. But what we are doing and are responsible to do is to do a wraparound. And it means that we have to identify our high-risk settings, that we make contact with them, that we proactively engage them. Because there has been really interesting research, and it even puzzled me. And it was research across London where there has been insight work with focus group in the community to actually ask people whether they knew how to get a test if they feel symptomatic. And 50%, now it was a obviously specifically chosen sample amongst communities that are not mainstream, 50% of those people said they didn't know or they weren't sure. Now, if you think that we want to do effective outbreak control, it is obviously hinging on having a test first. So one of the pleas in a way is with you and your community contacts is making sure that people understand where they get a test. Very, very important as well is that there's lots of work going on around recovery in Merton, and really exciting work around recovery. Outbreak control is really focusing on what it says on the tin, managing positive cases and their contact so that they don't spread. Very important when we think about the timeline. So as I said to you, at the moment, London, the infections are low. And also we measure positivity rate. So our positivity rate for tests is low. So these are all very encouraging indices at the moment. But as I said to you, things can change very quickly. So we think we can really have July and August for response readiness. But we want to be ready when the autumn comes, because we feel autumn and winter is another really high risk, potentially high risk period, because people obviously move indoors. We know that crowding is enjoyed by this virus. The virus seems to prefer cold rather than, or cool rather than warm. So if people drift inside, plus they start to splatter and cough and sneeze because of seasonal respiratory illnesses, we might be in trouble with the second wave. And so we're very keen that we get ready in the 2 months we have. And so there are some asks. If you give me the next slide, Chris. So obviously, and I think we've heard it from Love Wimbledon, they have done a great job. So hand washing, social distancing, the safe opening again of the town centres. I think people are doing a really good job. You will have heard the mandated face coverings complementing that. The symptoms, I think people are generally aware, but it is the testing. So if there is one message, is do the testing. And if you think about the learning from Leicester, in the cases that we have been seeing in Leicester are not particularly ill. So the hospitals are not overrun. The GP practices are quiet. So these are people who are a bit sick, but not terribly sick. So that you have to convince people that actually it is worth their while to get a test. And some people are also suspicious. They say, oh my God, if I have a test, then there is this contact tracing. I don't trust it. I feel uneasy. And unless we build the trust, we will lose our main tool to manage the outbreaks. And what is very important is that Merton Council has support, because sometimes people feel, oh my God, if I'm asked to self-isolate now, 14 days taking out of my life, I can't do it. Merton Council provides support. If businesses are worried that their staff has to isolate, these are the issues that need to be brought into the open so people understand what support is out there. And another big issue that you might come across, because once you ask more to find out why people are a bit suspicious about testing, is some are really worried about fraud. And again, we have sent out through, I think, the Chamber of Commerce as well, and business networks, awareness raising. So how can you protect yourself against fraud? They never ever ask for any details or any money, and there's a specific number. There's obviously quite a lot of experience that the NHS has got with contact tracing. So TB has a long tradition. We haven't there seen a lot of fraud, but this is obviously on a different scale. So I think we have to be alert. If you give me the next slide. So that's coming towards the end. These are the other community actions that we can do, and these are particularly for reducing the health impact. So as I've already alluded to you in the previous slide, really important to say the NHS is open. We have in a way succeeded during the peak to tell people not to overrun the NHS, and we love the NHS and we stay at home, we stick it all out. That now needs to be reversed, because we are worried that people are not coming. So very, very important message with our NHS partners. There are campaigns saying the NHS is here for you. And again, if you have contact, please make that clear. And the other important message is get COVID fit. So basically, as I said to you, late presentation, poor overall health, poorly controlled long-term conditions are all predisposing to particularly serious COVID. So if you can stop smoking, if you can lose weight, if you can increase your physical activity levels, all those will make you COVID fit. And again, we are focusing particularly on some of our most vulnerable communities, where we are aware that the impact was particularly serious and tragic. So some of our long-term conditions, as you are aware, amongst diabetes, Southeast Asians in particular, we're working closely with our GPs to invite them all and to make sure that their long-term conditions are better managed. The other one you can do is get the flu jab. Again, if we get flu on top of COVID, then it's a double whammy on all accounts. So let's at least get flu protected, flu protection as much as possible. And then not to underestimate the mental health impact of COVID. Is only slowly coming to the fore, And again, I've given you in the last slide some resources that are accessible and available, whether it be digital or phone, that please to spread as much as possible, because a number of people have suffered quite a bit in silence without knowing how to get help. So if you move on. Questions. And then I've got just some resources in the other side.
So Dagmar, thank you so much. Thank you for all that you've updated us on this evening, and certainly I would add my voice to yours in terms of everybody this evening being able to disseminate this information, and please do tell your neighbours and friends about the services that are available and the things you've heard this evening. So Dagmar, five questions for you, I'm afraid, so quite
right.
to go through. And as I said to Stephen at the beginning, I'll give you the questions now, and then please take as much time as you want to prepare, and then answer them all in bulk. But some of them I think are just your thoughts. The first one is the covering of mouths and noses at stations and trams, as well as actually on trains. This seems to be something that some people are struggling to get used to. So do you have comments on that, particularly around education, and how people may be educated, the importance even at tram stations and train stations as well as on the trains? The second question is, what thoughts do you have at this early stage? You've obviously got a massive task on your hands at the moment, but the medical care, social support and financial support needed in the long term. So for people who have been very seriously affected by COVID, who perhaps have been very ill, and will be requiring long-term support, are there measures in place for those people at the moment? The third is, and this one is going to be quite tricky, I'm afraid, but we would welcome your views on whether what has happened will have an impact on housing policy. So will it be that density has to change to allow better social distancing? Will we have more homes in the future with workspaces and learning spaces? And will apartments have to have separate entrances? And will there be restrictions on communal areas? And I think, Dagmar, to be fair to you, I think it's just more of a general, with your professional expertise, just your general thoughts on that sort of area. Number 4 is, are there any plans at this stage for how flu vaccination programs may operate in the autumn, given the requirements of social distancing and also the fact you've highlighted that flu is not going to be helpful? And number 5, you flagged diabetes. Are there any plans to reduce diabetes among residents in the borough? Dagmar, in fairness to you, that's a very wide range and quite detailed question. So please spend as much time as you want giving some thought. And then if you're able to address all of them together, that would be great.
Yeah, so why don't I start? Nothing is perfect. And as you said, I can give you a flavor and some consideration. So first of all, picking up the face coverings, there obviously has been quite a lot of discussion, because the bottom line is that the evidence isn't overwhelmingly fantastic. And so that's why in a flu season, we're not asking people to use face coverings, because it is a balance between the effectiveness and basically the inconvenience. We also always look at possible harms, and that also needs to be considered. Could possibly people, for example, fiddle a lot with their face because it's itching, and then they have it on their fingers and then they transmit it? So all of this have been serious considerations, and you will have seen the discussions involved at WHO. On balance, I think the majority of current scientists have now come to the conclusion that because COVID is so widespread, that even the little effect that it brings, and it protects or it prevents the wearer from spreading rather than the people around them, is better than nothing, and outweighs in any potential harms or inconveniences. And so Some people will disagree and will continue to disagree because it is a fine judgment. It is not a barn door in striking evidence. And so I think leading by example, also in a way making it practical. So in Merton Council, each staff member gets automatically 2 reusable face coverings. They don't cost the bomb, and we are sustainable, so we use the reusable ones. That helps, and I think elsewhere, if people make them available and lead by example, they probably become normalized. It's always when you change something that people find it very difficult. I am pretty convinced that soon it becomes socially more unacceptable not to wear them. And I think we can all do our a little bit on that. With regards to the medical care of the long-term impact of those who had COVID very seriously, I think it's a really very well made point, and an area where we are learning. It is only in the aftermath that we can see that what we generally say is a mild disease for the majority of people actually can be a real chameleon and can, on rare occasions, cause all sorts of really rather horrible effects. Almost all body systems can be affected if you are unlucky, and those who have spent weeks in intensive care will need rehabilitation. And you will have heard that the NHS is mobilising now to set up particular rehabilitation services, and that is also in discussion in Southwest London. So luckily, numbers of these very serious cases will be relatively small, but really important that we can help residents in Merton if it is the case that they can be referred appropriately. And I think you're absolutely right, more will come out and more learning and research is happening as we speak. I think it's important for employers as well. So the idea that after 2 weeks it's all done and dusted. I think the nation probably learned when the Prime Minister fell ill, and there he was pretty bullish, day 5, still doing his video conferences, and then he wasn't seen for a bit after he left intensive care. So that, I think, brought it home in that for some people you can't just shake it off, and you have to allow reconvalescent. What is going to change about housing policy, if only I knew. But what I think we also have to be wary of, that everything we are now bending for COVID, that I would think is not the way to go forward. If I just give you an example, before COVID, I was definitely one of those who very much promoted intergenerational housing. You know, it has so many advantages, and obviously intergenerational housing has proven to be particularly problematic in COVID and for COVID. So you're absolutely right to say we need to rethink, but I think it is also, we mustn't pour the baby out with the bathwater. And there are many things that we can learn from COVID, but human beings are wired to have social contact. And I think in your hint that we need to try to be innovative to allow social contact and be able to social distance if it is required is the sort of new ask. I mean, again, lots of research happening. So if you're a researcher at the moment, that's you're lucky. In terms of flu vaccinations, go and get them. I think health services are open now, and particularly if you are eligible, please don't skip it. This year in particular, if you skipped it before, if your asthma is only mild and you really have forgotten most years to have the flu vaccination, this year is the one that you mustn't forget it. And nudge your friends, neighbours, employees, whoever you know. There's a massive effort in the NHS so that there is enough vaccine. There's a massive effort that you can get the vaccine from the pharmacy and from the GP, from the bigger branches of supermarkets, etc. So all efforts are already in preparation so that we make a success of that one. And then finally, around diabetes, you're absolutely right. You will remember the Health and Wellbeing Board has done a lot of work on diabetes, working with our diabetes buddies and champions. And there are two tasks really. We can prevent diabetes. We can even turn people who already have elevated blood sugars with better lifestyles back to normalities, the type 2s. So if we can indent and improve healthy living, particular weight, then we can prevent diabetes, and that means we need to change some of our environment, which makes healthy food choices and physical activity easier. And quite a bit of what we're doing around climate change is handily coming to also help us with a healthier environment. But for the immediate in July, August, September, I'm also saying you can do a lot of those who already have it to make sure that it is really well controlled. And that is work in primary care, because most of those who have diabetes are looked after mainly in primary care.
So Dagmar, thank you so much. Thank you for your contribution this evening. And thank you for all the information you've given us. So that's Dr. Dagmar Zuna, the Director of Public Health at Merton. Thank you very much. So we're now moving on to the next agenda item, which is an update from the Wimbledon Neighbourhood Planning Group. And that, I gather, is led by Lynn Gordon. So Lynn, thank you very much for being here, and over to you.
Speak with you this evening. Actually, it's my colleague Deborah Crosby who's going to start off this evening, and I'm going to finish off. So over to Deborah first of all.
I apologise. So Deborah,
Don't worry.
you're very welcome too, and over to you. So Deborah, have you unmuted yourself? You may still be on mute.
I think I just lost
I've done it, sorry.
Yeah.
So yes, first of all, thank you very much for inviting us onto this forum so that we could just tell you a little bit more about what it is that we've been doing and why we think it's important. Listening to all the previous speakers, you may think, you could be forgiven for thinking, indeed, you know, why, when there's so much going on at the moment, do we need a neighbourhood plan? And I think actually it is precisely because there is so much going on at the moment. So before the kind of, you know, the latest things to hit us with the pandemic, with the economic problems that we're kind of seeing happening now and further down the road, there was already signs of things that we're going to be changing and changing fairly rapidly. One of those is that, you know, Wimbledon had been identified as an area of opportunity in the London plan, so it's seen as an area for growth, which is something that we definitely welcome. On the high street, the shops have been struggling as they compete with online. Climate change, there's some very sort of ambitious targets now for reducing carbon emissions. All of that is putting pressure on us and indeed the council. We listened to Stephen talking about how much money it's going to cost and how that can't be funded just by the local resources. And that's something where we think we can really help, because we've got we are volunteers and we've got resource to plough in there. It's really, if we could have the next slide, please. It's really about empowering the local community to determine the policies for future developments. We are so sorry. It is resourced by volunteers. We will get a small grant that is given to us by central government, but basically we are really sort of doing it for ourselves. And a lot of the time we're going to be spending will be in terms of canvassing what people's opinions are, what it is they want from their community, so that they can make it a better place to live, a better place to work, a better place to relax in. And the important thing about it is that this kind of coming together of the local community, which isn't just residents, it's businesses, it's local landowners, it allows us to determine policies that planning applications need to meet in order to be approved. So it sits side by side alongside the local plan. And therefore it has real kind of statutory weight and has real teeth, which makes it quite an exciting thing to be involved in, and also a very meaningful thing to be involved in. The plans were introduced in the Localism Act by central government in 2011. Since then, there have been nearly 3,000 communities have prepared one. Respectively rather fewer in London than we might have hoped for, but we're really keen to make Wimbledon the next. If we could have the next slide, please. So the sorts of things that a local plan, a neighbourhood plan can do, it can affect the way that the building looks and its location. It can affect the way that buildings and the built environment is designed. So the materials that are used, and as well as the overall kind of design. It can take into account things to do with public safety. So things to do with, you know, how wide are the pavements. It can even affect certain things to do with modal transport, accessibility for people who've got certain disabilities or slightly or who are rather infirm, and sustainability, which as we know is something that we've all got to grapple with and something that we can all benefit from working together on. It also allows us to identify, protect and improve green spaces. So some of these have already been listed, and so they're protected by statute anyway. But within the plan, we can also identify premises that are held with particular affection by people or businesses in Wimbledon, and we can protect them and we can write that into the plan. So essentially what we're trying to do is make Wimbledon a better place to live, to work and to visit. For us, really importantly, we recognise that we do have to develop, that we do need a flourishing community, and we need something where people can really enjoy living and working and spending leisure time in. So we're not going to be anti-growth, and neither are we a lobbying group. We're very much about facilitation and about canvassing and finding out and bringing people together, particularly the different interest groups, which I guess in the past don't always have so much to do with each other, and we have more of a kind of adversarial relationship between, you know, developers putting in an application and then people putting in or canvassing against it. And what we really want to do is to generate an environment where there's a better understanding, so that residents understand more about the businesses and more about what happens within local government and what's important in planning, and that it all works in more of a kind of virtuous circle, and gets and puts a plan that puts us on the front foot. If we could have the next slide, please. So yeah, we love it. We want to see it grow and evolve. We want to bring everybody together to help achieve that mission. And it's really about supporting and preserving the best of what Wimbledon has to offer, making sure that as new buildings are built, that they are of the highest quality and they fit within the surroundings and are sympathetic with them. We want to provide benefits for communities and businesses within the area. Now, that's not just to do with the place itself and the way it looks. I think that can be very much to do with the way of working, and just the nature of the process, and being involved in the forum will give people a sense of involvement and an opportunity to participate in something that's really important to them, which everyone can get something out of. We believe strongly in putting sustainability at the heart of our ideas and of our actions. It's something that, you know, the climate emergency is upon us. We believe that with better understanding and with more forethought, things can be considered a little bit earlier, and that will be to the benefit of anybody who lives and works here. So I'm going to hand over now to Lynn, who's going to update on the group itself and our status.
Thank you, Deborah. Could I have the next slide, please? Thank you. Many of you will probably be aware that various discussions and meetings were going on about setting up a neighbourhood group over the past 2 to 3 years. And I'm delighted to say the group was finally inaugurated on the 25th of January of this year. We've spent this time since then clearly defining the aims of the group and putting together resources and people to really achieve the task in hand, or the tasks in hand. And our next milestone is to gain designation as a neighbourhood forum, which then can create the neighbourhood plan. Our application, which we're in the process of preparing, needs to include a boundary of what we want to define is the area covered by the local plan. And that has to be supported by residents, businesses, and the communities inside it. So our immediate task really is to define the area to be designated and to continue to build a representative and diverse membership. And then once designated, we can get on with the real work of designing the plan. The next slide, please. Now, the current map we're working to, as you can see from this, the total area, of course, is the borough of Merton. And then the purple area is the proposed area at the moment. How we got to the area is that we wanted to represent the larger Wimbledon as such, the total Wimbledon. So we started off by drawing a circle really around the old civic centre, which is now the centre court, of course, of a mile radius. And so it really stretches from Wimbledon Park to Merton Park and from the Wandle across to the Common. And what we're doing at the moment is to going around and talking to the various residents and community groups within the area to see whether they want to be part of the area or not. It is a very democratic process. The whole thing is a democratic process because the community gets to vote on the plan once it's produced and can either accept it or not accept it. And there are various reasons, why you would or you wouldn't want to be in. Perhaps some areas don't identify as being Wimbledon and they don't want to be part of it. And perhaps some areas, in talking to them, a couple of them said, well, actually, we prefer to have our own neighbourhood plan. And obviously, you can only have one neighbourhood plan in one area. But that we've started that process of talking to people. And if anybody wants to come to talk to us about their area, then please do get in touch. I mean, obviously, we've been severely hampered the past few months by the pandemic. But I think everybody's now getting, as this meeting tonight, we're all getting to grips with far more online discussion and conversation. And hopefully we can start to move this forward at a faster pace. Could I have the next slide, please? So really, just to say, this is a community project. We are local volunteers and we are committed to delivering a better future for Wimbledon. To be accredited by the council, we need the whole community to support our work by becoming members. Membership is free, it's without any obligation, and joining means that you can have regular updates on the progress, and you can actually have a voice. Most importantly, you can have a voice in deciding the priorities for the future of Wimbledon, and you can have a say in the crafting of the neighbourhood plan. So if you do want to do that, then please register as members at www.wimbledon. It's all written down, please do so. And if you want to take a more active role in shaping Wimbledon's future and volunteer, please contact the secretary at the WMPG and we can discuss what role you might take within the group. Next slide. And that's really just to say thank you very much for listening to it. I think we'll probably be in touch with you soon, or you can be in touch with us. And if you've got any questions, please do ask. Thank you.
So Lynn and Deborah, thank you both so much for coming along and briefing us on this. I'm a great fan of the Localism Act, and I've now chaired this panel for 6 years, and as veterans of it will know, I am very excited about the idea of direct democracy and people participating in their own government. So right. It's a really exciting initiative, and thank you both so much for all you're doing. And I'm very inspired, and I know others will be, when you talk about participation by residents, about the community feel, about the fact there'll have to be a vote at the end. So this is really, really good stuff. So some comments have come through. I think that the one that I'd like to pick up on, because it sort of encapsulates, I think, a lot of them, is one of the challenges you'll have is ensuring, and both of you actually referred to a broad base, but ensuring that there is a broad representation, a broad base of views, and making sure that this fantastic initiative isn't accidentally hijacked and that vested interests take over on certain occasions. So can I ask how your thinking is going on that to ensure that that doesn't happen? And then the other question that's come through that I wanted to put to you is what thoughts do you have in terms of the work being done by Future Merton and the plans being outlined for the borough by that also very exciting initiative? How do you see the two working alongside each other and hopefully complementing each other? So thank you.
I'll start off. I mean, certainly in terms of the kind of broad base, that's absolutely right. And I think one of the things that we would do when we start is look at all the kind of groundwork that was done amongst local people in the preparation for the Future Merton plan. I mean, I certainly remember being party to some of those workshops that happened in above the library, and I know that a heck of a lot of work has already been done and was put into that, albeit that some of that might need updating because things have moved on, obviously, as we've been talking about tonight, but that would very much be our start point. I think the other thing to say is that in my personal background, I was a researcher. I was a strategic planner. I used to work for Diageo Drinks Company, and I was actually responsible for consumer research and translating that into strategy. So I'm very much, and Lynn too is from the same background, just coincidentally. So I'm very much onto finding out what matters to people, and research was always my kind of bread and butter, if you like, and understanding what is most important to them and turning that into policy is going to be a big challenge, but it's something that I feel really strongly about. It's not our views, and it needs to come from everybody. I think the other party to that, it's not just doing the research, it's making sure that we've got a broad enough base to start with, and that's ensuring that we've got real strong representation across the borough, across Wimbledon, across our area, of businesses, of people in different communities, all the different constituents, groups, the faith groups, different ages, and at the moment, we're fairly early on that journey, I would say, and it has been a little bit hampered by COVID, because we haven't been able to go out. What we had planned was to have stalls set up in Centre Court, and actually have a big kind of recruitment campaign. And as soon as we think that it's the right time to be able to do that sort of activity, that's certainly what we will be doing. And we're actually halfway through sort of devising a communications plan that will be about making sure that we've got that representation in that broad base, and then we'll be asking them questions, surveying them, doing all the diligent research that you would expect that we do.
Can I really just add that one of the criteria for designation is to be broad based, so if we achieve that in order to be designated anyway. And in terms of comparing it to the Wimbledon, are you talking about the Merton plan or the Wimbledon SPD?
So the work specific.
There are so many, but I think a lot of what we will be producing will fill in the gaps, because obviously the SPD only goes so far, and we would like, I think, as the Wimbledon community, to take our local knowledge and begin to fill in the gaps and produce something which is truly beneficial to all the communities.
Okay, well, thank you both very much. Whilst you have been talking, and for the benefit of everybody, quite a few comments have appeared. They're not questions, so I won't put them to Lynn and Deborah at the moment, but obviously please do look at the comments to all of us. This is to all of us. Please do look at the comments that have been made. So we're now drawing to the end of this meeting. So a couple of housekeeping points as we finish off. We haven't obviously been able to have the meeting that we would have liked to have done tonight in terms of more interaction. But I am very grateful to Stephen Allen Brittus, to Helen Clark Bell, to Dagmar Zuna, and to Lynn and Deborah for your excellent presentation just now. But thank you to everybody who's participated. Thank you to everybody who's asked questions. If we find ourselves doing this again in the autumn meeting, we will try to have a bit more interaction. But obviously it's a work in progress, I'm afraid, as we're all finding at the moment. The dates of the next meetings at the moment are 7:15 on the 23rd of September, and then 7:15 on the 1st of December. So those are the two dates that we have coming up. And I would just like to finish by not only thanking those who've spoken tonight and those who've asked questions, which I've done, but also thanking the support team of officers who at the council who have managed to make this meeting happen. And my screen froze at one moment, which scared me, but it didn't last very long, luckily. So thank you to everybody who's helped to make tonight happen. And thank you to all of you for attending. And therefore, I will now close the meeting and wish you all a good evening. And hopefully we will all convene again in the autumn. But thank you very much and good night.
Good night.